Hey guys, this is Unacademy Future Doctors, and I am your educator for biochemistry, Dr. Shivangi Shukla. Let me just check if I'm visible and audible to all of you and if the live stream has started. Just give me a minute to check if the live stream is running or not. Okay, great. So I'm currently running a 2 questions per day series here on Unacademy, on the channel Unacademy Future Doctors. In this, I'm taking up 2 questions in each session, and in each of the questions I'm discussing, I'll give you 5 minutes to answer each of the questions here in the live chat, and after the 5 minutes are over, then I'll be discussing the topic regarding the particular question. Okay, so today I have discussed a lot of important topics like translation, hemoglobin, 2,6 biphospho, 2,3 biphospho by 2,3 BPD, right? Um, and and a lot more other topics. So every day I discuss about 6 questions. I'll be discussing 6 questions because 3 sessions I'm taking. So this is the third session. And also tonight at 10:15 and at 11:15 I'm taking the MBBS series, that is the MCQ bonus biochemistry session, 18th and 19th and 20th sessions. Yeah. On the Unacademy app. Okay, so please do enroll yourself for that also, and they are absolutely free. You can attend that. Okay, I'll just quickly brief you about the types of NEET PG subscriptions that are available on Unacademy, the Iconic as well as the Plus subscription. Both will give you access to video lectures, both live as well as recorded, by top educators across the country. Also, you can access the question bank containing more than 25,000 questions, and that gets updated regularly. You can access their notes in the PDF format, and all these are available using state-of-the-art tools. And you also can interact with the educator using ask your doubt feature, raise your hand feature, through the polls. Okay, and the Iconic subscription in addition will also give you access to resources from Prep Ladder. All right, now the prices are already highly subsidized, and if you want additional 10% discount, then please put in the educator code Dr. Shukla, DRSHUKLA. Okay, this code is going to fetch you an additional 10% discount, DRSHUKLA, Dr. Shukla. Alright then guys, let us begin. Okay, the rules are simple. You look at this question and then you answer this in the chat section. Okay, and then I'll be giving you a full 5 minutes to answer this, and then we'll discuss the reasoning behind it. Okay, now the question is, there's an assertion reasoning type of question. The assertion is, fetal hemoglobin has higher affinity for oxygen compared to adult hemoglobin. And the reason that is mentioned here is P50 for fetal hemoglobin is higher as compared to adult hemoglobin. Alright, now the options are A, both assertion and reason are true and reason is the correct explanation for the assertion. B, both assertion and reason are true and reason is not, but reason is not the correct explanation for assertion. C, the assertion is true and reason is false. D, reason is true and assertion is false. Okay, understood the options? You must have solved a lot of assertion questions earlier as well. So you know the drill. You've understood what the question is asking of you. Just look at the two statements, the statement of assertion and the statement with reason, and statement of reason, and then try and reason it out. All right, then your 5 minutes start now, and all the best. Okay, let's see who gives the correct answer. Try it out. Everyone attending the session should answer. Okay, there should be no shame or no hesitation in even answering wrong. All right, because that is only going to unleash your creativity. Okay, the main purpose of solving MCQs is to develop a thought process. Okay, to give direction to your thought. Otherwise, what happens is you don't know how to go about it. You're lost while you're attempting MCQs. while sitting at the in the examination hall at the main day, on the main day while sitting in the examination hall, you will be totally blank, okay, and there'll be a lot of nervousness because you haven't practiced before. So this development of this thought process is extremely important, okay. Come on, your time has already started. Almost 1 minute is going to be over. Come on, come on. Everyone should answer. It doesn't matter. Do not be bothered about it being wrong. Come on, guys. Try and attempt this. Come on. Tell me. Last 2 minutes left, guys. Alright, so the last 30 seconds and then I'll tell the answer, okay? Last 30 seconds for you to analyze and then I'll tell the answer. Fetal hemoglobin has higher affinity for oxygen compared to adult hemoglobin. P50 for fetal hemoglobin is higher as compared to adult hemoglobin. P50 for fetal hemoglobin is higher as compared to adult hemoglobin. Now the question is, now the options are both assertion and reason are true and reason is the correct explanation for assertion. Both assertion and reason are true but reason is not the correct explanation for assertion. Assertion is true and reason is false. Reason is true and assertion is false. Okay? Got it? So now I'll be telling you the answer. See, the first statement that fetal hemoglobin has higher affinity for oxygen compared to adult hemoglobin is absolutely true. Okay? Now, fetal hemoglobin does have higher affinity for oxygen as compared to adult hemoglobin. The second statement, that is the reasoning, which states that fetal hemoglobin, the P50 for fetal hemoglobin is higher as compared to that for adult hemoglobin. The second statement is false. It is opposite. Okay, the P50 for fetal hemoglobin is lower as compared to that for adult hemoglobin. Okay, so assertion is true and reason is false. The correct answer is C. Okay, got it? The correct answer is C here. All those who got the correct answer, congratulate yourself. And what is the explanation? Let us see. Okay, now as discussed in the last session, I guess, where I talked about a few allosteric properties of hemoglobin, I mentioned how hemoglobin is a tetramer, isn't it? Because it contains 4 heme chains. Alright, hemoglobin contains 4 heme molecules, and one heme molecule is capable of binding to one molecule of oxygen. Alright, so one molecule of hemoglobin, which contains 4 molecules of heme, will be able to bind to 4 molecules of oxygen. Okay, now what happens is, so this tetrameric structure is the quaternary structure. Okay, now what happens is, once one oxygen molecule has bound to hemoglobin, the affinity for the other 3 oxygen molecules increases many-fold. Okay, so this is called allosteric effect. What is an allosteric effector? An allosteric effector is that molecule which binds at an allosteric site and increases the efficiency of the enzyme. Okay, the allosteric site is a separate site from the active site. Active site is where the substrate binds. The allosteric site is a separate site where the allosteric effector binds. And after binding to the allosteric site, it will increase the efficiency of the enzyme. Okay, similarly, once the oxygen molecule binds, it will itself become the effector for binding of other oxygen molecules. Got it? So this kind of binding is called cooperative binding. That is, all the oxygen molecules are cooperating with each other in associating with hemoglobin. And similar is the case during dissociation of oxygen from hemoglobin. Okay, once one oxygen molecule dissociates, the affinity for the other 3 also progressively decreases. Okay, therefore this leads to the Bohr effect. What is the Bohr effect? That is association of oxygen at the level of lungs to hemoglobin, where the PCO2 is low, and association and dissociation of oxygen from hemoglobin at the level of tissues, where PCO2 is high. Okay, so this is how the cooperative binding and allosteric effect functions with respect to oxygen and hemoglobin. Now there is one term called P50. P50 means, P here denotes the partial pressure of oxygen. Okay, and what is 50? 50 means half. Okay, 50 is with respect to 100. This means half. So this is the measure of the partial pressure of oxygen at which the hemoglobin molecule is half saturated. Okay, half saturated with oxygen. Excuse me. So P50 is the partial pressure of oxygen at which the hemoglobin molecule is half saturated with oxygen. Alright, so if a particular type of hemoglobin has a high P50, that means it will require a high concentration of oxygen for it to be saturated. And if a particular hemoglobin has low P50, then it will require a low concentration of oxygen to be half saturated. Okay, so what does it mean? Something that gets saturated at low concentration of something else will have a higher affinity, right? Because even if it is present in low concentrations, this hemoglobin can go and find it out and attach to it. Okay, but for the suppose that you can compare adult and fetal hemoglobin here. Okay, for ease. Now fetal hemoglobin has a lower P50. What does it mean? that even when the oxygen concentration or the partial pressure of oxygen is lesser, it can still find out oxygen molecules from the mixture of air and it can combine with it, because it has a very high affinity. It can smell oxygen out. Okay, it can smell it out. Okay, but with adult hemoglobin, it will require a higher concentration of oxygen to be able to find it out from the mixture and get attached to it. Okay, so higher the affinity, lower is the P50. Lower the affinity, higher is the P50 for the hemoglobin. Okay, now since we are talking about different types of hemoglobins, let us discuss the development of hemoglobin. Hemoglobin develops as in the embryo. There are two types of hemoglobins. The first type is the Gower 1 chain. Gower 1 hemoglobin contains 4 chains, tetramer again. Okay, these 4 chains are zeta 2 and epsilon 2. Okay, 2 zeta chains and 2 epsilon chains. Okay, zeta 2 epsilon 2 is the first hemoglobin that develops. Now the zeta 2 chains are very rapidly replaced with the alpha 2 chain. Okay, so the first chain chain from the adult hemoglobin that is synthesized is the alpha 2. Beta 2 comes in later on. Okay, so two alpha chains very rapidly replace the zeta chains, and next type of Gower hemoglobin comes, that is alpha 2 epsilon 2. Okay, these two, Gower 1 and Gower 2, are embryonic hemoglobins. Okay, they are present only till the first trimester, till the time embryo, it is called an embryo. Next, once it becomes a fetus, the epsilon chains are rapidly replaced by the gamma chains. So what is the constitution of fetal hemoglobin? Alpha 2, gamma 2. Okay, so the major differences between fetal and adult hemoglobin are because of differences in alpha and beta chain. Because once the fetus is born, the gamma 2 chains are replaced by beta 2 chains. Okay, so it becomes, the adult hemoglobin is alpha 2 beta 2. Okay, understood? Now this we have discussed in the last session, where the oxygenated part of hemoglobin, because of the chain effect, the chain, that is when iron, which has been with 4 coordinate bonds of iron have been satisfied by the 4 nitrogen atoms of the 4 tetrapyrrole in this cyclic tetrapyrrole. So, but the 2 other coordinate linkages of iron are still left. One of them is satisfied with the histidine F8 molecule from the globin chain, and the other is bound to is formed between the oxygen that binds to hemoglobin. Okay. Now, once oxygen binds to hemoglobin, it pulls the his F8 molecule also, because everything is connected to the iron. And once the histidine F8 molecule is pulled up, what happens is the ionic linkages that are formed are broken. So the ionic linkages were keeping the hemoglobin molecule taut. Taut means separated, taut, tight. Now what happens is, once the ionic linkages have been broken, what happens, the hemoglobin collapses into a compacted structure. And because the ionic linkages are broken, so this structure is called a relaxed structure. Okay, a relaxed structure, compacted structure, oxyhemoglobin structure. Now, since it is so compact, it does not have any space for 2,3-BPG. 2,3-BPG stabilizes the T state. That is what we read. Okay. Now, what happens is, the fetal hemoglobin contains the gamma chain. Okay. Now, gamma chains cannot form salt bridges. The salt bridges, remember the salt bridges that were broken by association with oxygen. Those salt bridges that are existing in the deoxy form, they are formed by beta chain. Now, since this gamma chain that is present in fetal hemoglobin cannot form these ionic linkages or salt bridges, what happens is, the T state in fetal hemoglobin is not very stable. Okay. So, the 2 reasons why fetal hemoglobin prefers the oxy state is, one of them is that the gamma chain cannot form salt bridges. So, R state or the oxy state is preferred. It is more stable. The second is that the P50 for fetal hemoglobin is lower. Therefore, it can get saturated with oxygen half saturated with oxygen at lower partial pressures of oxygen. Got it? Understood that it is very, very important that you understand the relation between P50 and affinity for oxygen. Okay, so shall we move to the next question? A young male presents with sudden painless diminution of vision in unilateral eye. On examination, unilateral eye means one eye. On examination, visual acuity is reduced to 1 by 60. There is splashed sauce appearance on the fundus and macular edema. Okay. Serum homocysteine levels are increased. Alright. Next is, what is the most adequate treatment for the raised homocysteine levels? So what are the most important keywords here? Young male, sudden, painless, diminution of vision, visual acuity reduced significantly, splashed sauce appearance on the fundus, macular edema. This is going to be clinching. These words are clinching your diagnosis here. Serum homocysteine levels are increased. Another supportive statement. Now it is not asking you the treatment for the eye condition. Okay, it is asking you the treatment for raised homocysteine levels. What is the treatment for raised homocysteine levels? A. Supplementation with pyridoxine. B. Supplementation with B12. C. Supplementation with methionine. Or D. Supplementation with folic acid. Okay. Got it? So your time starts now. Start answering. Alright. All of you should consider the question. Consider each and every option and then answer. Okay, your time has already started, guys. Come on, guys. Start answering. Last 2 minutes left for you guys to answer. Then I'll tell you the correct answer. The correct answer. Most adequate treatment. Most adequate treatment for raised homocysteine levels. Okay. Most adequate treatment for raised homocysteine levels, sudden painless diminution of vision. Significant loss of vision. The significant loss of vision, I'll tell you, is due to macular edema. Okay, let me help you here. The person seems to be suffering from central retinal venous occlusion along with macular edema. Per se, just central retinal venous occlusion does not affect the vision much unless and until macula is involved. Okay, got it? Now, it can be due to raised blood pressure, it can be due to a very important cause in young patients is homocysteine levels, increased homocysteine levels, because it is atherogenic. Okay, so shall I be out with the answer? Shall I tell you the answer now? Just 30 more seconds. The correct answer here is, okay, so the correct answer is A, supplementation with pyridoxine. What is pyridoxine? Pyridoxine is vitamin B6. Okay. Now the answer can also be supplementation with B12, but the most adequate treatment, as it is being asked, for homocystinemia or homocystinuria is supplementation with pyridoxine. Okay. Supplementation with methionine is a strict no. Methionine should be restricted in the diet. And why is it so? Because this is the metabolism of methionine. Methionine is an essential amino acid. It is a sulfur containing amino acid. It is present in pulses. Okay. Now, what is the function of methionine? Methionine, while we were discussing translation today as well, and we discussed that methionine is coded for by AUG, and it is the first amino acid that is tagged to the tRNA by amino acyl tRNA transferase enzyme, isn't it? Amino acyl synthetase enzyme. Now, how does methionine get metabolized in the body? Okay, there is a very important reaction that involves methionine, and that is the one carbon transfer reaction. Okay, what is one carbon? Methyl. Methyl isn't in inorganic chemistry. Methyl is the R group that contains one carbon. So methyl group gets transferred from one substance, from one molecule to the other, and that is called one carbon transfer reactions. What are the two most important substances involved in this? Vitamin B12 and folate, folic acid. They are involved in one carbon transfer reactions inside our body. So let us see how it happens. Methionine gets converted to S-adenosyl methionine, which is the universal methyl donor. This S-adenosyl methionine is the one which gives the methyl group for capping. Remember, capping also we read today in tRNA, in translation. So methionine converts to S-adenosyl methionine. S-adenosyl methionine converts to S-adenosyl homocysteine, which then converts to homocysteine. Okay. Now this is a cyclical reaction. Homocysteine can in turn convert to methionine, and this is what involves the one carbon transfer reaction. Here, the methyl tetrahydrofolate, it changes to tetrahydrofolate and gives its methyl group to homocysteine. When homocysteine gets methylated, it becomes methionine. Okay. Now this methyl tetrahydrofolate, methyl THF, now becomes THF after donating its methyl group to homocysteine. Now we require a constant supply of TSH. Why? Because further conversion also needs to be there, right? It is not just one molecule that needs to be converted. So to replenish THF, to replenish methyl THF, methyl cobalamin will now come in. That is methylated vitamin B12. Methyl cobalamin will now come in, and it will give its methyl group to tetrahydrofolate, and it will itself become cobalamin, and this tetrahydrofolate has now become methyl tetrahydrofolate. So this is a very important one carbon transfer reaction that is occurring. But do you see that conversion of methionine to homocysteine is a cyclical reaction? It is a reversible reaction. Okay. Homocysteine converting to cystathionine and then to cysteine through cystathionine biosynthase enzyme and cystathionase enzyme. This is an irreversible reaction. Homocysteine first converts to cystathione through cystathione biosynthase, and then it converts to cysteine through cystathionase. Okay, both of them will have vitamin B6 or pyridoxine as the cofactor. So this is where our treatment, our star pyridoxine will come in. Okay, homocysteine, when it is high in the body, what we want to do is we want to convert it into other products. So one option is you can convert it to methionine. Okay, but then methionine will then again convert to homocysteine. So the better option is for you to convert it into irreversible cystathione and cysteine. And mind you, cysteine is also a sulfur containing amino acid. So you see this whole, it shows how methionine converts to cysteine. Both are sulfur containing amino acids. One of them is essential, that is methionine. Cysteine is not essential. Why? Because it is getting synthesized from methionine. Okay, understood? So vitamin B12 also you can give, which will speed up its conversion to methionine, but since it is reversible, it is not going to be of much use. Therefore, the most important treatment is pyridoxine, which will speed up the conversion of homocysteine to cystathione and then to cysteine and eliminate the homocysteine. And homocysteine being atherogenic, it can lead to CRAO, CRVO, myocardial infarction, shock, a lot of ischemic events. So did you guys understand? Okay, understood this. This has been asked time and again in PG entrance examinations. So make sure you know this. Through this diagram, your one carbon cycle has been, it can be very easily explained. So always, you just make sure you draw this diagram, practice this diagram. Okay. Also, you should know where pyridoxine is involved and where vitamin B12 and folate are involved. Okay, all of this is very, very important. Okay guys, then thank you, and do subscribe to this channel if you haven't. Share it amongst your friends, improve its visibility so that we get a lot more interactive student touch classes. Okay, bye bye. Do remember I have two special classes tonight at 10:15 and at 11:15 on the Unacademy app. Both are MCQ sessions, MCQ bonus biochemistry sessions, MBBS. Okay, I expect to see all of you there. Okay.